we'll go on to universal health care. And you recently spoke at the forum with the other candidates. Can you break that down for us?
Yes, I can. The forum was in Las Vegas and was sponsored by the SEIU, a labor union and Podesta's organization. Andy Stern, very, very important labor leader in this country, came forward and said, look, at labor and management finally got together and realized that putting the healthcare system on the business is really not very smart. And that's what we've been doing. Here's how it happened. In the Second World War, we had a freeze on wages. And so companies, in order to induce people to come to them, they gave perks out in the way of health care. And so after the war, there's no freezes on wages, but that historic precedent continued. And so what it's done, along with the taxation system, it has disadvantaged American industry. It has disadvantaged American workers who have lost their jobs as a result of manufacturing moving abroad because they don't have to carry the healthcare system or the taxation system when they're competing in Europe and in Asia. Now, we ought to have the good sense to understand that, but that's not what happened. After Andy Stern spoke, Edwards came out with a plan to sock it to the business more, make them pay more for health care, turn around and raise the taxes. We don't have to raise taxes. 30% of what we're spending on health care is all paper. It's all going to the insurance companies. All we got to do is control cost, and we'll have enough money to pay for health care for everybody. If you turned around and passed a law and just said that the pharmaceutical industry would have to sell their drugs in this country at the same price they sell them worldwide, that would produce a $150 billion advantage right now, and that in itself would pay for what we need to cover the 40 plus million people. So the answer is not to add more onto business and then lose your job. The answer is to find a new way to do it. Now, not only did Edwards come out with that plan, but what Governor Richardson said, well, at the end of 1 year, I'll have a universal plan in place. Well, I got to tell you, don't hold your breath on that one. Secondly, Hillary came in, she had no plan, said that she had the marks from trying it before. She had a very poor plan before, but she had no plan now. But she's saying that at the end of her second term, you're going to have universal health care. That's 9 years from now. Stop and think how ridiculous that is. We could do it now if we had the will. And then, of course, Obama, he didn't have a plan. They asked him, well, what are your thoughts? Well, I just filed for office. He was 6 years in the state legislature. He 2 years as a senator. He's not thought of health care. Didn't have a plan. But he said, just hang tough. We're going to have a plan here shortly as soon as we complete our focus groups. That means put your finger in the wind and find out which way it's blowing. And then if Kucinich, who I like very much, but all he could do is beat on the insurance companies. Well, the plan that I had was very simple. We will have a voucher. Everybody in the United States will get a voucher, and they don't have to pay for it. It's a voucher that provides for basic health care, period. And if they want more than the voucher provides, and the voucher could be somewhere between $8,000 and $10,000, and it will be individual specific. That means that we will be able to take the data, the computerized data of your health records and your health experience in the prior year, and then that would be what we would assign the value of your voucher for. And if you had a cataclysmic occurrence, that could be absorbed by the insurance companies, because you're only going to have 4 or 5 plans. None of these 3,000 or 4,000 plans available to you, where all it is confusing. 3 plans, 4 plans, and if the insurance companies don't shape up, we'll have a plan from the government. So you'll have choice. You'll be able to go to whatever doctor you want, whatever hospital you want, and if you want more, you can then buy another policy for more services than what you get and everybody will be identical, no cost to it. How do we pay for it? We pay for it with a national retail sales tax. It's part of the fair tax that I'm talking about. Now, I want to tell you candidly, I get to be president, and if the people are not empowered to make laws, I can't get the healthcare system, I can't get the new taxation system, I can't stop the war. that the American people have to be empowered to do that. If the people had the ability to make laws today, they could immediately stop the war. They could turn around and have a health care system that's worthy of them. And they could, of course, do a whole host of other things, term limits in for people in office, you name it. The people have to be empowered to become lawmakers because, here, stop and think. There's a problem. We know things are not working well in this country. The problem is with the government. There's only one other area, the people. We have to go to the people for that solution. And so I want to be president, and I think I can be a good president, and I'll turn this country around 180 degrees the minute I'm sworn in. But for what I want to accomplish, I need the people to work with me as a partner. I want to be a partner of the American people, making laws, making policy that the people understand and they decide on it, because there's nobody more qualified on the policies that affect your lives than the people who can hear my voice right now.